Ankle dorsiflexion is basically what's happening at the ankle anytime we bring the top of the foot towards the shin. Now, if the foot is off the floor and we're expressing ankle dorsiflexion in an open chain manner, that's just going to look like we're doing a tibialis raise and just flexing at the ankle. But in closed chain ankle dorsiflexion, we have the foot fixed firmly to the floor without moving, and that's going to have us getting the top of the foot closer to the shin by bringing the knee over the toe. When the foot is flat on the floor and the knee is traveling in the direction of the toes, bringing the ankles into dorsiflexion, the arch of the foot is going to have to flatten out slightly, which is going to allow the talus to glide appropriately and allow for the tibia to internally rotate. This whole process is known as foot pronation. Now, as we are moving through the squat pattern and sinking into our deepest squat position, our knee is naturally going to travel further over the toe while our hip is moving into flexion. This means that our knee is naturally going to move into the deepest ranges of motion of flexion as well. Now, considering during the dorsiflexion process there is foot pronation, which requires tibial internal rotation, if the tibia can't rotate internally through enough of a range of motion to allow for the knee to flex to the extent that it needs to through the squat pattern, there's going to be some unnecessary stress placed at the knee. So naturally, improving ankle dorsiflexion is going to also help reduce the amount of unpleasant symptoms that you're experiencing.